Welcome to the module Preventing Sepsis, a Frontline Forces training presented by Superior Health Quality Alliance or Superior Health. This learning module was developed for direct caregivers working in multiple healthcare settings who care for a variety of patients. It is also relevant for family members caring for a loved one in the home. Direct caregivers play a very critical role in providing care to individuals in many settings of care. Why? Because direct caregivers spend a great deal of time with their patients, which helps them to know and better understand the needs of those individuals. The purpose of this course is to further your learning and build on your current knowledge about preventing sepsis. What you know and how you use that information improves the quality and safety of the patients in your care. This learning module, Preventing Sepsis, is the second module of a two-part series that explores the important role direct care staff have in both early recognition of sepsis and in the prevention of sepsis. You are viewing the second module of this series, which provides a general overview about preventing sepsis. It is not necessary to complete the entire series of modules in one setting. You can leave and return to any of the modules at any time. Once you've completed this learning module, you may test your knowledge and understanding of the material by completing the quiz. The objectives for this module include: discuss the importance of early recognition and sepsis, describe healthcare practices that prevent sepsis, and explain next steps when you suspect sepsis. Early recognition of sepsis saves lives. Sepsis is the body's extreme response to an infection. Sepsis can be life-threatening, particularly in the more frail and older adults. Timely identification and treatment are very important to save lives. While older adults make up 20% of the United States population, over 67% of the patients admitted to the hospital with sepsis are elderly. This results in over $41 billion in annual costs for hospital admissions for nursing home patients alone. The impact of sepsis on older adults. Older adults with sepsis are more likely to be admitted into intensive care units and have longer hospital stays. Patients 85 years of age and older are much more likely to die from sepsis. Sepsis in older adults can lead to several long-term effects, including a decline in mental functioning, loss of the ability to perform activities of daily living, and physical disabilities. Prevention of sepsis. The next few slides will discuss important actions that caregivers can take to prevent sepsis from occurring. Hand hygiene. Hand hygiene is still the most effective action that caregivers can take to prevent infections from occurring. It's important to follow the Center for Disease Control and Prevention's hand hygiene guidance for healthcare personnel. Healthcare personnel should complete hand hygiene with an alcohol-based hand rub in the following situations: immediately before touching a patient, before performing an aseptic task such as working with an indwelling device or handling an invasive medical device, before moving from work on a soiled body site to a clean body site on the same patient, after touching a patient or the patient's immediate environment, after contact with blood, body fluids, or contaminated surfaces, and immediately after glove removal. There are specific conditions that do require the use of soap and water, such as in the case of Clostridium difficile or C. diff, or when your hands are visibly soiled. Oral care and prevention of pneumonia. Poor oral hygiene may lead to complications such as pneumonia, and in turn, pneumonia can lead to sepsis. There are several important steps that caregivers can take to promote oral hygiene and decrease the risk of pneumonia. These steps include observing patients for difficulty breathing, talking, or gurgling, cleaning oral secretions immediately to prevent inhaling mucus, and notifying the nurse if the patient has increased secretions or is unable to clear them effectively. Promoting a daily fluid intake of 6 to 8 cups of liquids. Of note, there might be some patients who are on fluid restrictions, and if that's the case, you would want to follow the recommendation of the registered dietitian or the medical provider. Wound and skin care. Open areas of the skin can allow germs, including viruses and bacteria, to enter the bloodstream, causing an infection which can lead to sepsis. The following actions are steps that caregivers can take to prevent open areas from developing into sepsis. Observe the skin daily during cares. Report any new red or open areas such as blisters, rashes, bruises, or injuries to the skin immediately. Keep the skin clean, dry, and moistened. Wash your hands and apply gloves before touching a wound or providing wound care. Watch for signs and symptoms of infection, which might include fever, increased redness of the skin, pain, or drainage, and report changes to the nurse immediately. Catheter care. Persons with urinary catheters may develop catheter-associated urinary tract infections. When this occurs, bacteria enter the bloodstream, causing sepsis. To prevent this from occurring, follow these steps. Keep the catheter collecting tubing free from kinks. Always keep the collection bag below the level of the bladder. Do not rest the collection bag on the floor. Empty the collection bag regularly using a separate clean collecting container for each patient. Avoid splashing and prevent contact of the drainage spigot with the non-sterile collecting container. Provide routine hygiene, such as cleaning of the skin around the catheter's entry point during bathing or showering. And finally, use the appropriate personal protective equipment during catheter care. Vaccinations. Vaccination is an important way to reduce the risk of contracting several infections that may lead to sepsis, such as pneumonia, influenza, and COVID-19. Vaccinations help stimulate the body's immune system to produce antibodies that protect a person from further illness or disease. Vaccinations protect both patients and caregivers from serious disease, reduce the severity of the illness, and prevent or decrease hospitalizations, particularly in older adults. Next steps if you suspect sepsis. The next slides describe the important steps that caregivers can take to identify and prevent sepsis and save lives. Change of condition notification. Sepsis is a life-threatening, serious medical condition that requires prompt identification and treatment. As a caregiver, you spend the most time with patients and are likely to be the first person to recognize a change of condition. Notify the licensed nursing staff promptly whenever you observe any of the following: fever, shivering, or the individual expresses feeling very cold. New onset of increased confusion, mental decline, or a change in behavior. Severe pain or discomfort. A change in breathing or in the respiratory rate. A respiratory rate of less than 12 or greater than 30 respirations per minute. Clammy or sweaty skin. Odorous urine. And remember that early symptoms of sepsis may be non-specific, meaning the resident or the patient will tell you they don't feel well, but they can't be specific about the symptoms they're feeling. Test your knowledge. Congratulations, you've successfully completed this module. It's now time to test your knowledge by taking the quiz. Click on the link for the sepsis prevention quiz on the Frontline Forces webpage or in the YouTube description below. You may find the following resources helpful if you wish to learn more about sepsis prevention.